everybody. Welcome back. My name is Darlene Merkler, and I'm with Inland Caregiver Resource Center. I'll be here on Facebook Live every Tuesday and Thursday at noon. And this week, I'm talking about cognitive and behavioral changes in Parkinson's disease. And part one was on Tuesday. Today, I'm going to be talking about part two. And on Tuesday, we talked about some of the behavioral changes, and just briefly, but mostly we talked about the cognitive changes. So I want to go into more detail about the behavioral changes today. The behavioral changes that we notice with Parkinson's disease is apathy and loss of initiative, which we talked about on Tuesday, that looks a lot like depression and can coexist with the apathy. Also, cognitive fluctuations, and a new word that we learned on Tuesday, including myself, punding, Punding, which is repetitive movements or handling and examining objects. And then the fourth behavior we're going to talk about today is agitation. So the first one, apathy and loss of initiative. And we talked a little bit about that on Tuesday, that is associated with depression and dementia. And a few weeks ago, I talked about, is it normal aging or dementia? And we talked about how depression and dementia in the early stages looks very similar. It's the same thing with dementia and Parkinson's disease as well. The apathy is characterized by reduced interest and motivation in goal-directed behaviors, indifference, and flattened effect. So you can see those behaviors sound a lot like depression. So the reduced initiative, effort, and perseverance that a person might have is diminished. Also difficult to distinguish from depression, as we talked about. The cognitive fluctuation, there's a pronounced variation in alertness and cognitive performance over the course of hours or days. So it can fluctuate throughout the day, or maybe one day we're good and the next day we're not. We talked a little bit too about dementia with Lewy body's disease, and just because I know Parkinson's and Lewy bodies is very similar, so I want to give you some figures that were given to me, and that is that the cognitive fluctuations with Parkinson's disease is about 29%, whereas the Lewy bodies, it's about 42%. So it's a little bit different there. The punding, and I can't believe in 30 years of working in this industry, I've never heard that term before, but punding is repetitive. I know I'm very familiar with what it is, I just never heard it called that. It's repetitive, pointless behaviors, repetitive manipulations of technical equipment, and continual handling, examining, and sorting of objects, excessive grooming, hoarding, or fidgeting with clothes or oneself. A couple things that we used to do in the Alzheimer's assisted living that I used to work in is we would put different types of fabrics in a basket: wool, burlap, silk, cotton, and our residents used to like to just hold that basket and feel all the different textures. The other thing they talk about in here is part of punding is sorting of objects. So we would get people to help us sort socks from the laundry, or fold washcloths and things like that, things that they were able to do and they felt useful and that they were helping. The other part of punding is the interruption of activity from an outside source usually produces irritation, anxiety, and frustration. So if a person is engaged in this type of activity, we probably don't want to try to redirect them. We want to allow them to do that as long as they're not doing anything that is harmful to themselves. The next behavior is agitation. And I'm sure with all Alzheimer's, dementia, Parkinson's, and maybe just even normal aging, we've seen agitation in older adults. And the different signs of agitation would be restlessness, pacing, impulsiveness, and combativeness. So the agitation usually occurs um, because of possibly because of a medical condition. Perhaps the person has a lot of times we would check for a urinary tract infection because a lot of times when people have memory loss, they can't explain what they're feeling, why they're in pain. And so they act out and they have aggressive behaviors. And so the first thing we would do when I worked in the Alzheimer's community is we would check for a urinary tract infection. And a lot of times that was the key right there. If you see a big change in your loved one's behavior, especially agitation, that's a good thing to check for. Also, it can be a cause of medication interactions. So we want to make sure that whatever physician you're taking your loved one to, that they're aware of all the different medications that your loved one is taking, even over the counter, vitamins, pain medications, and things like that, because medications can interact. All medications have side effects, and sometimes it's not good to have two different medications together, especially in a person with memory loss. Along with the medical condition is pain. A person with Parkinson's disease or who has dementia may not be able to verbalize that they're having arthritis pain or back pain or whatever type of pain they may be experiencing, and so instead they act out. So we want to check for pain. They may be feeling overwhelmed. Things like changing environment. I think I mentioned to you when I was talking about is it normal aging or dementia that I had a client one time. It was 5 or 6 siblings, and they thought they were doing the right thing, and they would have mom go to each one of their houses for a couple months out of the year. That was probably easier on the family, but that's very difficult for the person with memory loss. That a person with memory loss likes routine, and changing houses like that and changing the people around them can cause agitation. So changing the environment, traveling. I have talked to so many families where they want to take their loved one on vacation with them or on a trip, and some people can handle that, but most of the time, if there's memory loss involved, it's going to be very challenging for the person with memory loss. Also, hospitalization, especially right now, because of COVID-19, we're not able to go in the hospital and visit our loved ones or in the nursing homes. And so they're alone, they're surrounded by strange people, and that can be very disconcerting for a person with memory loss. And then also moving. So if they move from their home that they've been in for 40 or 50 years and then they go into a nursing home or assisted living or hospital, that can be overwhelming for them. A change in caregivers. So even if the person's living at home and you have caregivers coming in, they get used to the same person. And if a new person comes in, they may be agitated. Just along that line, I remember working at the Alzheimer's assisted living, and some one of the most common issues with Alzheimer's patients is showering. Some people with memory loss are afraid of the shower. And even though we had certain techniques that we used that were helpful, um, it was interesting because sometimes we would just change caregivers and then the person was fine. And we don't know if a certain caregiver triggers something in their mind from a long time ago, somebody they didn't like, or whatever the case may be. But sometimes a change in caregivers can be a positive thing too. If there are people in the house guests, especially if they're staying, I always talk to to caregivers about the holidays, having a lot of people in the house, the Christmas lights, the music, kids running around, and lots of noise. It's really better to have the person with memory loss in their room and have one person at a time visit them. All that going on with strange people in the house and things can be overwhelming for a person with memory loss. And then misperceived threats. Paranoia is very common with memory loss, so we want to be aware of that when we're dealing with our loved ones. So all these kinds of changes can trigger agitation in a person with Parkinson's and dementia. Fear and fatigue from trying to make sense out of the confusing world for them. So they can get pretty exhausted trying to figure out what's going on and why aren't they remembering and why are these strange people in my house and things like that can make them very exhausted. And when they're tired, they might lash out verbally or physically. So, what are some of the treatments? That's what I want to finish up here with today. And just before I get into this, I'm not a doctor, and this information is from the Parkinson's Foundation, and I would definitely check with your physician before stopping or starting any kind of medications or even behavior patterns with your loved one, because your doctor knows your loved one better than I do for sure. But what the Parkinson's Foundation recommends is eliminating psychoactive medications like Xanax and Valium and other medications like Benadryl and pain medications like opioids and things like that can trigger behavior issues. Again, let's not start or stop any of those without talking to your doctor. You want to make sure that any medical conditions are being treated, such as sleep apnea. This is true for all of us, but in particular, someone who's already confused. Urinary tract infections, as I mentioned, are very common. Anemia and other medical issues often mimic or worsen the cognitive impairment. So we want to make sure they're seeing their doctor on a regular basis to make sure nothing physical is going on. Blood work and things like that need to be kept up. And then identifying and treating psychiatric conditions like depression. We talked a little bit about this on Tuesday, whereas when the depression is treated, it almost looks like the dementia is getting better. And in fact, the dementia and depression are very close in symptoms. And so you may see an improvement in behaviors if the depression is addressed. So anxiety, psychosis, um, they can interfere with cognition and worsen behavior problems. So that might be a good place to start is checking for depression with your doctor and seeing what type of treatments they might recommend. To reduce or prevent agitation, we want to make sure we create a calm environment, remove stressors, try soothing rituals. There's a huge study done on music and dementia, and especially we want to make sure we're playing the music that your loved one likes from their era, not rap music necessarily, but the music that they grew up listening to. And it's amazing, even if a person cannot communicate, how music can really help. We want to avoid environmental triggers like noise, glare, background distractions. We want to monitor their comfort. Make sure they're, again, not in pain. Are they hungry? Are they thirsty? Are they constipated? Do they need to go to the restroom? And are they tired? And then simplifying tasks and routines. I mentioned this before when I talked about Alzheimer's and dementia, but if uh, we want to allow the person with memory loss to do as much for themselves as possible. However, there will be days when it's very frustrating for them. And so in those days, we do want to help the person. Okay, and then I just want to close out here because I'm almost out of time. Again, I have more to cover. There's a lot of information on this topic, and so if you would like to have my handout, I'd be happy to send that to you if you message me here on Facebook or contact our office. One of the things they talk about as far as dealing with behaviors is exercise. And with Parkinson's in particular, with dementia, it can slow the disease progress. It can improve motor skills, which is one of the major symptoms of Parkinson's, and it can help with cognition. Again, you might want to check with your doctor as far as what type of exercise would be best for your loved one. I also have, like I say, other information that I'm not going to have time to get into today, but I'd be happy to share it with you. Next Tuesday and Thursday, I'm going to be talking about art therapy and health. And believe me, I'm not an artist. And this is just really simple things that we can do for ourselves as caregivers or for our loved ones that we're caring for to keep us happy and keep us focused and keep our mind off of everything that's going on in the world today. So I want to finish up today just by saying that Inland Caregiver Resource Center is a nonprofit organization helping family caregivers and seniors over 60. We do still have funding. It's almost gone. So if you know anybody who can benefit from up to $125 worth of groceries delivered to their house for free, please contact our office today because it's just about finished with all that funding. I'll be giving 4 1-hour presentations in June, and I put that schedule on our Facebook page. We have a Parkinson support group that meets once a month, as well as 10 other support groups. We're going to be starting a 12th support group in June, the third Thursday of June at 6 in the evening. I'm going to be running a caregiver support group, and we'll be posting more information about that. We still have counseling services available, case management, caregiving services. So we have lots of things to offer family caregivers. If you have any questions, please contact us. I hope you have a wonderful weekend, and I look forward to seeing you next week. Have a great day. Bye.